excellent. Well, welcome everybody. Thank you so much for being here for our Pride Ortho AOSA collaborative webinar about intersectionality in medicine. When AOSA initially reached out to us about this, the goal was for our organizations to engage with each other's membership, just so that we can all know that we're out there, we're queer, and we're here. And so we wanted to take an opportunity to introduce our respective organizations to each other's membership, and then also highlight some of our wonderful faculty members and with who have intersectional identities, and hear what they have to say about their experience with their intersectional identities in medicine. So to get started, so I'm Ezra, and I'll be presenting about Pride Ortho to start us off. So Pride Ortho, we're an organization specifically for LGBTQ plus and ally individuals within orthopedics. And our goal when we initially founded this was to provide mentorship for folks and provide networking opportunities, and then really kind of create this sense of community and belonging for queer individuals and allies within orthopedics. So one of our big missions in Pride Ortho is mentorship. We recognize that mentorship is huge in medicine, in surgery, in orthopedics specifically. And in previous surveys of LGBTQ identifying folks in medicine, 72% thought that it was important to have an LGBTQ identified mentor. And then for personal development, and then 59% thought it was important for career development. So obviously there's a big need for mentorship, and so that's something that we really like to provide for our members. Another thing that we're really involved with is networking. In order to get ahead in any field of medicine, networking is huge, but then also it's just important for people who are in this community to know who else is there and to really kind of utilize those resources and those connections. And so we provide networking opportunities at various meetups at orthopedic conferences. We also have industry relationships with industry providers. We have research opportunities that we can connect people to. We also have committees, and we love for our members to get involved with our different committees. And then we network across organizations like we are right now with some of these organizations, and then also like AOSA, of course. And then as far as what like resources we're providing to our members, one of our big things is that we have a list of LGBTQ plus inclusive orthopedic residencies and fellowships on our website to give people an idea of where they might feel welcome. We also provide scholarships for fourth-year medical students who are going to do away rotations. We have a database of LGBTQ plus research in orthopedics, and then also just orthopedic research being conducted by some of our LGBTQ plus identifying members. We put on pretty frequent informational webinars for our members. And then one of our newer initiatives is called the Pride Ortho Medical Student Initiative, or POMSI for short, which is a program where medical students of all identities are welcome to come and hear from LGBTQ plus and ally orthopedic surgeons, and also work with like sawbones, which is something that we use to practice orthopedic kind of procedures, and then also like practice suturing, and hear also from like residents, orthopedic surgery residents. And so just a good way to get some early exposure for med students to see the representation of LGBTQ plus and ally folks in orthopedics. And then community is huge. So outside of networking, just having like more colloquial, more collegial kind of community is important too, and feeling like you, like as an LGBTQ individual, are welcome in orthopedics, and that you have your own LGBTQ community in orthopedics. So we have what are called the out list and the ally list. And these are resources that are available only to members. And these are lists of folks who are members of Pride Ortho who identify either as an ally or identify as being out as LGBTQ plus. And these are things that people opt into when they become members. So there's no obligation to sign up, but it is really nice for other people who are coming along to see this list of our representation visually in front of them. And then also we have a newsletter that comes out every couple months that just kind of shares what's going on and keeps the community up to date on what we're up to. And then of course, social media is huge for community. And so there you can see we've got Instagram and X accounts if you have any interest in learning more about what Pride Ortho has been up to. So that's my spiel about Pride Ortho. If you have any interest in becoming a member, we would love that. Or if you want to follow us on social media, those are our two handles. If you have any questions about anything, you can email us at info@prideortho.org. And then our website is www.prideortho.org, and you can find more information on there as well. All right, so next we're going to transition to AOSA.
All right. Hi, everyone. My name is Amber Sheth. I'm I use she, her pronouns, and I'm the current AOSA resident representative. I'm also a PGY2 general surgery resident at the University of Wisconsin in Madison. So I have here the mission statement of AOSA or AOSA, however you want to say it is fine. But we're the LGBTQ plus organization for surgeons. Doesn't matter your specialty, doesn't matter your identity. Allies are welcome as well. We want to promote acceptance, inclusion, and equity in surgical specialties to further both our own careers, to learn from those who have come before us, and to support those who are coming down the pipeline. We create spaces for queer surgeons and trainees to find community with one another, to find spaces that are free from discrimination and stigma. And the way we do this is through a combination of a bunch of the same things and a bunch of the same kind of mechanisms that Ortho Pride works through. So outreach, mentorship, and encouraging professional development. So I just have up here a couple of our member offerings. This is just a smattering. We have a mentorship program. I put that QR code nice and big in case anyone was interested in scanning the code. That links to a Google Doc where we have a program to match up mentors and mentees. This is open to anyone who is interested in either being a mentor themselves, finding mentorship, or as in my position, both at the same time. And we've had really wonderful feedback so far from folks who have been paired up in terms of specialty interest, queer identities, regional location, things like that. We also host webinars such as this one. I also have the flyer there for one that we did earlier this year that was celebrating queer joy in surgery. We also have several podcast collaborations with Behind the Knife. And we have engaged in several other kinds of programming for our members. One example of those are this past summer, we did regional meetups for Pride. And so the picture there is the one that I hosted along with Dr. Nicole Neidlinger in Madison, Wisconsin at a local queer-owned brewery. Although one of the great things about AOSA is the ability to make nationwide connections, it also enabled me to meet new people in the area who I didn't know were queer and were out even at my own institution. So that was really fun. And then our national meetup, or AKA our regional meeting, will be held at ACS this year. So I would like to make a plug for all of our members to come out to our annual meeting. It'll be October 19th. Venue to be announced. And like I said, it'll be in San Francisco at this year's ACS conference. And lastly, we would love for you all to get in touch with us. Definitely check out our website, www.outsurgeons.org. There you can find not only our offerings, but also things like job postings, more about our mission, more about ways to get involved, whether that's through research, whether that's through industry connection, whether you want to join a committee. We also have institutional memberships. Who knows, maybe an institution where you're at is a member already, and you can easily become a member. And hang out with all of us. And then we also have an Instagram page and a Twitter page.
Awesome. Thank you so much, Amber. All right, so that kind of wraps up the introduction of both of our organizations. And next we want to move into the panelist portion of our evening. So Amber, if you want to go ahead and introduce Dr. Satterwhite, that would be great.
Absolutely. I have the great pleasure of introducing Dr. Thomas Satterwhite, who uses he, him pronouns. He is a plastic surgeon and craniofacial surgeon by training, who is the founder of Align Surgical Associates, which is a multi-specialty group based in San Francisco, which also has offices in LA that works exclusively with the transgender and gender diverse population to perform gender affirming care. I have been trying to get Dr. Satterwhite on a panel with us for ages, and I'm so excited to finally have him here, both on account of the work that he does with the transgender community, but also because of the various diverse identities that he holds. And I'm so excited to hear what he has to offer.
All right, and I have the pleasure of introducing our two orthopedic panelists. So Dr. Ayesha Rahman is a hand and upper extremity surgeon at New York Presbyterian Hospital in Queens, New York. She serves as a co-director of the hand surgery service, where she covers level 1 trauma. She holds multiple academic appointments, including assistant professor at Weill Cornell Medical College, assistant clinical professor at Columbia University, College of Physicians and Surgeons, adjunct faculty and team physician for St. John's University, and the teaching attending for the HSS Orthopaedic Residency Program. She completed her orthopedic residency at NYU Hospital for joint diseases and a fellowship in hand and upper extremity at the University of California, San Francisco. She obtained her medical degree from Georgetown University School of Medicine, where she was a founding member of their first LGBTQ medical student group. She additionally holds master's and bachelor's degrees in biomedical engineering from the University of Michigan. She met her wife in New York City 10 years ago, and they are happily married with 2 rescue kitties. They spend their time between their East Village, Manhattan apartment and a beach house near Fire Island. Dr. Rahman has been an active member of Pride Ortho since its inception, and she currently serves as the secretary on the board of directors. So, Dr. Rahman, thank you so much for being here. Dr. Andrew, oh, thanks. And then next we have Dr. Andrew Usoro. He is a sports medicine surgeon practicing at Kaiser Permanente in Atlanta. He completed his undergraduate studies at Princeton University, where he majored in chemistry and was also a sprinter on the track and field team. After graduating, he lived in Singapore for 2 years teaching high school, and then completed his medical degree at Wake Forest School of Medicine and went on to complete his orthopedic surgery residency at the Harvard Combined Orthopedic Residency Program. He later completed his sports medicine fellowship at the Kerlan Jobe Orthopedic Clinic in Los Angeles, where he was assistant team physician to the LA Dodgers. He and his partner Steve enjoy traveling together and working out. Dr. Usoro previously served on the Pride Ortho Board of Directors as co-chair of development. So thank you all so much for being here. So we can kind of kick off the discussion. Well, first let me stop sharing so that you all can see our panelists as they answer questions. So Yeah, so we can kind of get the discussion going by asking a couple questions, and then we would love for and if those of you who are here to send in any questions that you have. You can either send them in the chat, or if you want to actually turn on, like you can unmute yourself and ask the question. That would be fine as well. So the first question that I have for our panelists is, what does intersectionality mean to you, and how do you think your intersectional identities affect your role within surgery?
I'm happy to start with that one. Intersectionality is an interesting concept. It's something that I think applies to everybody and absolutely everybody, and that's what I kind of love about it. We're on this panel because we have, some intersectional identities that tend to fall more under like a minority category, but the truth is everybody has these identities. We all have a sex, we all have a gender, we all have a race, we all have a sexual orientation, a gender expression, and all of these things, make us who we are. I think what intersectionality means to me is when you are a lot of these things, some of these things tend to become more salient at different points in our lives or during different situations. That's what intersectionality means to me, is how we go through the world and how these identities affect our interaction with the world. In my experience, intersectionality, my most, I have multiple identities. So some of the things I identify as: I'm female, I am cisgender, I'm gay, I am brown skinned, I am Muslim, I am multi-ethnic. I, come from a socioeconomic background where my parents were war refugees. I have a number of these sorts of identities that definitely affect how I interact, but my most salient identity changes depend on where I am. Like, there are times where I feel like my most salient identity is the one that is most under attack. There are times when I feel like my most salient identity is the one that is most being celebrated. There are times when my most salient identity is the one that I feel like I am the majority of in the room, and then other times where I'm the minority in the room. So that's what has been interesting for me, is how your intersectionality can become more or less relevant or on your mind. There are times when, for example, like I often go through the world and I don't think about certain things. For example, able-bodied. It's not something I really think about, but that's definitely an identity that other folks may have much more salient in their lives. So that's something that intersectionality has meant for me.
Yeah, so Dr. Rahman, that was such a wonderful, eloquent answer. And I certainly agree. And I think intersectionality, and it was something that I had to embrace because I felt that throughout, most of my life, I had so many identities that I felt were in conflict with each other. And I oftentimes felt that I had to choose one over the other. And now I'm at a point, and it took a while, where I feel like I can embrace that intersectionality, that all of my different identities together actually can be a strength rather than a weakness or something that I'm concerned about. And so for me, I'm a gay cisgender man. I'm half Black, half Filipino. My mother, came from the Philippines, a very poor background, immigrant. So, and just growing up, having those identities, I couldn't find other people who were like me. And then what was also a little difficult was, as Dr. Rahman was saying, that sometimes, there are certain identities that people just focus on and you have no control. Like they're just stuck on that one identity and you're somehow pigeonholed into that and you're trying to navigate that. And that also becomes a very difficult thing. Or what's also difficult is if there's one identity that, someone, like for me, where someone would identify, where I would say, yeah, they would see me as a Black man and say that I'm also half Filipino. And it's like, well, does that really work? You can't, you're biracial, you have to pick one, right? Or that, once again, the African American side tends to be more prevalent, physically, but in me, both identities are equally important and they're not addressed or seen. And that has also been, a very difficult thing. But I think for me, I think having those identities really allows me to connect with patients from multiple, backgrounds, right? I can connect with those who are part of the LGBT community, African American community, Filipino community, folks, from a difficult socioeconomic background, because either these are things that I have experienced myself. And so that's definitely allowed me to be and to embrace that.
Yeah, I would just echo on that. And uh I think the thing that I've come to realize, coming from trainee to practice and kind of ending my second year in practice is, when I reflect on my time in medicine, in some ways medicine kind of wants to put you in a box, right? This is the type of med student you should be. This is the type of resident you should be, depending on your specialty. And then as I've gone into practice, I've really, I think, learned to celebrate, my different identities, right? And that's through connecting with patients. And so, I'm gay and I'm Black and I'm also an ex-Division I athlete. And so depending on who I'm talking to, any of those identities can really, resonate and help me connect with a patient. Even my time in Singapore, right? I lived there for 2 years. I traveled all over Asia, and if I meet like a Vietnamese immigrant, we talk about Vietnam because I've been to where they are from and they love talking about it. And so I think as I've kind of gone into practice, I've really learned and kind of consciously thought about what are the different identities that I can, kind of make more prevalent, and then really also learn to celebrate all of my different identities. Because I think as a resident and trainee, you tend to think, hey, if you're outside the norm, then that puts you at risk. But in reality, it's the opposite.
Yeah,
I
thank you.
just,
Oh, sorry. Go on.
oh no, I just wanted to say, I think it's so amazing to see just all of the head nods that are happening as people are finding resonance with what you all are saying. I think that's so powerful. Even if maybe we're not part of a racial or a religious or a gender minority, there's still ways in which we can relate to this idea of intersectionality, and still ways in which we all feel at various times like we're too much of one thing, not enough of another thing, expected to be something, but at the end of the day, we're just one complete person and have to somehow balance and navigate all of that. So I think I just want to say that's really powerful what you all are saying right now. And so I guess to leap off of what Dr. Usoro was saying about how it kind of intersected with your medical training, how do you think that having these multiple identities has impacted your experience within orthopedics or within plastic and craniofacial surgery?
Yeah, I'll start off with that. I think, orthopedics is interesting because I think there's very much like a stereotype of orthopedic surgery. And in many ways, I am that stereotype, right? I'm the ex-college Division I athlete who decided they like musculoskeletal problems and wanted to be a surgeon, right? That is like very much me. But at the other end, I'm also Black, which is less than, 3% of orthopedic surgeons, and I'm also gay. So those, I kind of felt we're in constant conflict with each other. And I both felt like I fit in within orthopedic surgery, but also felt like I was completely outside the box. And especially as a trainee, you're kind of constantly thinking of, okay, what did the faculty think of me? I felt like I had to maybe, I had to work a little bit harder. I had to prove myself, right, that I can be outside the norm and still be successful. And I think that is a conflict that, everyone, especially in surgery, really, really struggles with, is trying to, prove that you are worthy of being a surgeon or a physician or whatever role that you aspire to be in your mind.
Yeah, and I agree. It's interesting because like the comment that you're making about people just pigeonhole you and you just feel so stuck sometimes. Like for my training, as a plastic surgery, I think it's funny because like, as a Black man and I have being tall and muscular, people just assume that I was an ortho resident actually, or I was a rep, and I was like, no, I'm a plastic surgeon, right? So people have this like perception of what you should be based on how you look. And within the world, I think just in surgery in general, like overall, it's a very, heterosexual, relatively conservative, it seems like, environment, even here on the West Coast. So it was just hard to, you know, there were expectations that, I certainly needed to fulfill, but I was always so worried that there would be certain aspects of my identity that people would hold against me. So what I focused on was always working hard, working as hard as I could, being, the nicest, most considerate person that I could. And I think once people realize that, hey, this is, yeah, I've never met, someone who looks like him, but because he's someone who's working hard, is so dedicated, it doesn't really matter. And I felt that sometimes, once again, those identities that I had that were oftentimes perceived as being, negative unfairly, didn't matter so much. And I was being seen much more as a person. And I think that was helpful. And I think as I progressed also in my career, I felt that, I went to Stanford for college. I felt that, that was a time in my life where I was like, oh, I can really be as free and as open as I want. I came out and it was wonderful. Then I felt as I was progressing in my medical training, I was starting to like regress. I was like, oh my gosh, I'm getting more and more in the closet. And I was like, no, I can't do that. I need to come back out. And I think now that, no, I am in practice and I now have that freedom to really embrace all of the identities that I have. It was interesting because, like, when I was, coming to terms with all of my identities and trying to find folks in the community that I could connect with, I think I was so focused on trying to get acceptance from each of my particular identities rather than embracing, the uniqueness of who I was. And so I would get frustrated if, when I was in college and I was like, okay, I want to connect with the LGBT community. And unfortunately, there weren't too many gay Black men. And it was very, very homogenous, very white. And it was hard. I was like, okay, these are supposed to be my people, but, I'm not connecting with them. I felt racism, and then I was like, okay, I'm going to connect, with Black people. These are my people, my community. And I was like, oh, there's a bit of homophobia here. And, this kind of sucks. I'll connect with, like, the Filipinos, my people. And I was like, oh no, it's also a very conservative environment. And they're like, oh, you don't look very Filipino and you're too tall to be Filipino. It's just like, okay, this just sucks, And then as I moved on, it was just like, okay, this is fine. This is who I am. I just because I'm not, being embraced by each of my community, each of my identities that are important to me, that's okay. It's perfectly fine. And I've kind of created my own community. It was interesting. One thing I remember when I was applying into residency, and I found and I love the idea of that, there's the opportunity for mentor mentee relationships. But I remember I found it was a plastic surgery or ENT actually attending, and he was African American and he was gay. And so I was applying into residency. This was like 2006 or so. And then people told me about him. I was like, oh my gosh, there's someone who's just like me. And I remember saying, I so want him to be my mentor. And I came up to him and introduced myself. And he immediately felt, awkward. I was like, okay, this is not good. And I asked him for advice. And he's like, well, when you apply into residency, don't tell anyone you're gay. And I'm like, okay, and that was it. And that was our mentor-mentee relationship right there. And that sucked. It was someone, once again, who looked like me, the same background as me, but that was the advice that I was getting. So that was quite difficult.
And I'll hop onto that question. So what's been interesting for me in ortho is that, so it is, kind of bro-y. And the funny thing is being a woman, I was not treated actually like a lot of other women in my program because I look like this. And so I actually kind of got treated a little bit like a bro. And it was funny because like what I always try to do in our field, it is a homogenous field, but I think it's really important to build bridges and find like some kind of common ground, some kind of commonality that makes us so much more approachable and likable and part of our our profession, our community. And it's funny because like the things that they could relate to me about, it's like, you know, they would see me, and I happen to be married to a very femme woman. And when they look at us, we look like a straight couple, like a butch femme, you know, sort of like a straight couple. And they're like, oh, I get that. I know what that is. I can relate to that. And I'm like, you know what? It's not the same. It's like that comic where it's like a fork and a knife are asking two chopsticks, which one of you is the fork? You know, I'm like, it's not quite that, but I'm going to go with it because the truth is we do both have wives. And you know, there were like moments like that where I'm like, okay, these are things that are like kind of like relatable, and I'm gonna kind of go with that and build bridges. What I have tried and hoped to do is like to be approachable. And I think Dr. Satterwhite and Dr. Usoro kind of talked a little bit about, touched on this, is just that when you are holding that identity, you know, you are sort of seen as representative of that identity. And you want to make sure that like you're seen as good. Because like sometimes you are the one that carries the torch, like you want to open the door and leave it open after you. And so one of the things I wanted to make sure is that I always was approachable and not confrontational in any way, because the last thing I want to do is to make somebody uncomfortable. And then the next time there's a gay person that like, they make me uncomfortable, I'm uncomfortable and I'm not going to talk to them. I don't want to ask them questions. I don't want to make a mistake. There's no mistakes, you know, like if you don't ask questions, then I can't answer it. And if there's things out there that need to be addressed, then I want to address it, you know, and I want to do it in a way that's like helpful, you know. And so that's kind of one of the things that I always tried to do in a lot of these situations. Things got said, and I do my best to address it in a way that was like, well, what about not like, how dare you, you know? And so like, I think that's something that we kind of have to balance. When you are kind of like that one person in your program, you have to, it's hard to be the first or like the only of you, because you're the one that has to kind of like push aside all the garbage and like clear a path and kind of do it while leaving it open behind you. That's like, it's like a hard thing to do. We balance a lot, we carry a lot of expectations, and it's a lot of pressure. I think that's what we kind of all like sort of, you know, hint at. And it can be hard because we're doing it and it feels like we're doing it by ourselves. We're not like, it's kind of like that immigrant identity, you know, you're not really seen as American, but you're also not going to fit in if you go to your home country, right? Like it's where do you fit? And that's kind of sometimes how we feel like in our fields. Where do we fit? We're the only one of us in our entire program, and we're the first of us in our entire program. I don't even have someone to like figure it out. So I think that's like part of what we are trying to do with all of our organizations, which I appreciate, is to normalize the intersectional identity and make it okay for other people to like follow in our footsteps. It sucks when you get a mentor that was like, this was my experience, stay closeted. And then look at all of us who are on this webinar out and proud, telling other people, come to our webinars. So it is nice to see that progress, you know, I appreciate it. And all of you on the panel and all of you like tuning in, I think that it is always like a very nice thing that we can create a community and make ourselves like relatable and likable, because, you know, we're cool people, you know?
Yeah, and so I just to follow up on what Ayesha said, Dr. Jane had a really good question that kind of is a perfect follow through in the chat. It says, do you feel the burdens represent a specific identity? Do you feel under the microscope that if you make an error, then you have let down the community of one of your identities? Absolutely. And, you know, I kind of think of my identities kind of similar to, you know, kind of your medical training. And so, right, orthopedics is very, very small. So in order to get into residency, in order to get into fellowship, they're literally going to call their buddy at, you know, Northwestern and ask, hey, how is Ayesha? Or, you know, they're going to call NYU. And so in many ways you feel like that you are really like leading the torch to like create a pipeline. You know, I went to Harvard for residency, and you saw it even independent of identities. Well, if this person went to this med school, they're an awesome rock star resident. We're going to get more people from that med school because they produce good residents, right? And it's kind of seen the same way, right? Like I went from a very diverse, that really appreciated diversity at Harvard, and then I went to Curlin Jobe, which was a very kind of you know, white boys club, to put it very, very frankly. And you know, my program director went to Harvard, and yet, you know, I don't even know if they've even had a gay sports medicine fellow, right? And so in many ways, I felt like, oh, I have to be, the good, rock star fellow, because they're going to say, oh yeah, Andrew's gay. He was awesome. And so we're going to hire another gay resident because they're going to be good. Same thing, oh, Andrew went to Harvard. He was good. So we're going to take another person from that. And so every time I felt like, if I wasn't doing the right thing or, the hardest working, then in some ways I kind of let down my entire community, even though that's not true.
Yeah, it's interesting. Like a good number of my patients. So once again, all my patients are transgender, and I work a lot with transgender women of color, and particularly Black trans women. A good, very high percentage of my patients are Black trans women, and it's, I can't envision doing anything else, and I can't envision a group that has it the hardest in this country. But I remember there was, one patient that we were working with, and she was an African American trans woman, and we're gonna move forward with a breast augmentation. And she just was not, we realized she wasn't a good candidate. My PA, my physician associate, was speaking with her, and she was telling me that, okay, her expectations are off. She wants to have, 700cc implants put in, but her chest can really only accommodate like 300, but she's not listening to me. She's pushing back. She's calling me names. Really just not, this is not a safe, ultimately, situation to move forward. This was maybe 2 weeks or so before the operation. And so then I talked with the patient, and I did realize that she wasn't reasonable. She would not have been a good patient. She would have had a horrible outcome. And I knew that, I couldn't move forward even though she was on the schedule. And then I just remember her saying, and my PA physician assistant happens to be white, but the patient was like, how can you take your PA's side? She's a white woman. We Black people need to stick together. And I was like, oh my gosh, so I'm like, part of me was like, oh my gosh, maybe I'm letting her down. Maybe I'm letting down the community. But I was like, no, it's nothing to do with race. But yes, you do feel that it's a lot. And I know that a lot of, but I knew that this was the right thing for this patient. But, it is like, I want to do the best for my community. And there are very few, and I think all of us here realize that there are very few of us who have the background that we have, and patients gravitate towards us because of who we are. And if it doesn't work with us, there are very few other doctor surgeons who are going to be able to look like them, have the same background as them. So yeah, I do feel that pressure in terms of letting down my patients who are like me and have my, background and identities. But certainly balancing it out with what is safe and what is appropriate as well. But it is awkward when, once again, an identity aspect is brought up and used against you in such a fashion.
Thank you so much for sharing that. I feel like a lot of us probably can relate to that situation, and like maybe haven't found the right area to talk about it, or like who to share that with. But I think that's a very relatable experience that you had with your patient. And so I just appreciate your vulnerability with that. Um, we just got another question that I think is really helpful, especially for any like trainees in the room. Um, Barbara said, as applicants, how can we know if a program is safe for us without exposing ourselves? How do we find a mentor in the community who could guide us through the process as who we are? I'm married to a woman, so my answer to any family-related question in a residency interview will inevitably involve that. I moved to this country to be with her, leaving my home country residency. I don't want to hide her, but I also need to match. It's hard to balance this and also get the information I need to choose the right program to train. Thank you so much for that question, Barbara.
That's a tough thing to balance. And I think, we all kind of have our differing sort of views on that, on whether how much do you say, how much do you like sort of fudge, or how much do you kind of like change the conversation and that kind of thing. And I think at the end of the day, what we all want is to know that we're going to a program where we're going to be like safe and respected. And so we have tried to address this in Pride Ortho. We do have a list of residency programs that are vetted by residents, fellows, who have actually attended that program or attendings who are actually at that program. And so that's something at least we have, if it's an orthopedic residency, that's something that we've tried to address. And so that's available on our site. I know, I'm not sure about other like subspecialties. We also have, again, as far as like mentoring and guidance through that kind of process, again, we have a lot of these mentoring programs that, to try and connect people, because that kind of mentorship and guidance, it's hard to find in our community. Sorry, that was my cat doing zoomies. It's just hard to find that, in our community. So we do try and connect people. And a lot of mentorship is about finding like the right person. And we try and do a good job of asking a lot of questions to try and find people like the best match for where they are, in life. Someone who's applying versus like someone who's already in attending and has, those are going to be like different needs. So I would maybe advise you, to look into some resources and reach out to some folks through the site if you're going into ortho.
Yeah, and we have the same thing in plastic surgery. The American Society of Plastic Surgeons has the Pride forum. And so you can access that. You can reach out to folks, other surgeons, residents, and so you can speak with us, and then we can guide you along. I know that certainly, and it is important. As Ayesha was saying, it's so important that you are in a program where you feel safe. So yeah, what if you interview and you lie and you fudge, and then you go into this program and you're going to be there for a long time, like 6 or 7 years? Do you really want to be in this program where you truly are going to be unsafe and threatened, right? I don't know, right? So that's the thing that you really want to take into account, because I know, residents who have been in programs where they were, closeted when they interviewed, and when they, came out, it was pretty disastrous. And so, and I think we also just realistically have to think about areas geographically. I think there are going to be places, just realistically on the coasts that may be a bit more open than those, maybe that are in the South or in the Midwest. Not always, once again, I'm generalizing here, but those are things that you do have to consider. But certainly reaching out to mentors and the different groups that are listed here as well too.
And just to add off of that, so last year I mentored a med student, and we talked about this exactly. And I think for some people it's a little bit easier actually if you have a partner, and you can say, and that's kind of a very obvious reference, but he was single, and so he wasn't sure how to necessarily address that. So a general framework that I told him was that if you think about just well-regarded academic institutions, I think by and large will be completely favorable of that. In fact, from a diversity perspective, I think you would be, really well regarded, because I think many well-regarded academic institutions, at least from a residency application standpoint, really look for that in diversity. And then some community programs can be a little bit more variable, to be honest. And I've certainly known residents who are at community programs who had really excellent experiences, and then some that were kind of less than excellent. But I think the most important thing is that I think you be honest, because if you get a sense of a reaction or a discomfort, I think that it's going to end up being pervasive for 5 to 7 years. And I still remember some of my residency interviews where I met a resident. This was, not that long ago, since I'm in my second year of practice, where someone introduced their wife. And I was like, even if I didn't talk to that person, there was in the back of my mind, hey, that person has a wife, she is married to a woman. And that's all I need to know that it's a safe program. But I would say, if you generally stick to well-regarded academic institutions, less of an issue. And by the way, my med student ended up matching at one of the top programs in orthopedics, which I was like so happy and pumped for.
Yeah,
think that's-
I'm going to
Let's
add
go
one
ahead.
thing to that. Yeah, it's just it's getting harder and harder to match in general, and so a lot of times it's just kind of like you'll take whatever. At the end of the day, an orthopedic surgeon is like an orthopedic surgeon, and most programs offer, what we want is like a great you know, great training, and like you want to, of course, like have a program that can be supportive. But if it happens that, let's say, you end up at a program where maybe it's not, you know, the most friendly, or that it's not, they don't have maybe support programs that like maybe other programs or bigger coastal programs, there are still resources out there for you. Even if you end up at a program, let's say it wasn't like your top choice, it wasn't the best match. Let's say you don't have a lot of folks. What I would always, you know, advise you on is to look for community and support. You'll always find it. Like, we're all here. You know, I happen to be at a program that is like, has, you know, a DEI committee and an LGBTQ subcommittee and all of these things. That's great, you know, but there's also these types of national organizations that can provide you with like some amount of support, some amount of guidance. You maintain these sort of mentorship relationships, even if we're not physically there with you. This, you know, the LGBTQ community, specifically in ortho, we're not big. We're in a lot of places, but we're not big. And so that's one of the reasons why we create these kinds of national organizations. Even if you go by national numbers, you know, somewhere between, I don't know, 7 to 20% of us in theory, and whether that number actually trickles down to the surgery world, I'm not sure. You know, but it doesn't add up to a whole ton of numbers. So what I would say is maintain a community outside of your world as well, wherever you end up.
Yeah, and this also kind of segues into my next question. If you all would be willing to share, what was your experience like disclosing your LGBTQ identity in training, whether that was in medical school, residency, fellowship, currently, or maybe you haven't yet? I'm just kind of curious what that's been like for you all.
I can answer that. And I think for me, I've you know, I'm married, I have a husband. We've been together for 23 years now. So I met in 2000. Ooh, time flies. So but I met him actually when I was about to go to medical school. So this was in 2001. And then we just, you know, really just became serious. And I think what was like there, it was almost easier to come out. I think Andrew was stating this as well, because I did have a partner, and a pretty serious partner, and I didn't want to go through my training, which was obviously quite long, without anyone knowing who he was or me having to hide him. I think that would have just been a huge disservice to him and a relationship. I just couldn't do that. And so it was I think it was a winter, I think a holiday surgery party that I went to, and I brought him, and I just said, yeah, this is my partner, you know, my at the time, and I think that and people were fine. I think that, and I think as Ayesha was saying, that like folks have husbands, right? So like, you know, but and so I think people could relate to that. And I think what I had to do was I was just tried to be as comfortable as I could about it, not be awkward. Like people would ask, hey, what did you do over the weekend? I'd say, well, my partner, and then soon to become my husband and I did this, right? So rather than just like being evasive, I was just very blunt and direct. And I think that made it less comfortable for other folks. I know there were folks who were closeted and were vague about things that they would say, or the relationships that they had, or people they were hanging out with, and that just created a general sense of awkwardness. And I think for me, being as open and as honest as I could made other people feel comfortable. And once again, I was at Stanford, and it's a bit more of a just kind of an open, kind of just diverse and accepting environment, but still there really weren't too many, you know, gay people in training. But that was my approach, and it seemed to work well, and I didn't have much in terms of like negative issues.
So when I came out, it was pretty obvious. I showed up to our first conference in a suit and tie, and our program director was joking with me afterwards. He's like, "Oh, I see you got the memo about our uniforms." And this is like a conservative guy, you know, and I rolled with it. And then, you know, I was downstairs in the operating rooms as like an intern, and the chair of the program pulls me aside to his office and shuts the door. And I'm like, oh my God, what's happening? And he's like, are you gay? And I was like, oh, Jesus, am I fired? And he's like, well, actually, my son is gay, and I'm the mentor in the on this like, you know, like medical student LGBTQ group and so on and so forth. And it was basically like, you know, I see you, I support you. If anything happens, let me know. You know, I don't expect anything to happen, but you let me know, and let me know if you want to meet people and like that kind of thing. And so he was actually, there was like a tremendous amount of support when I came out. And I think a lot of it was truthfully because I was probably the first that they had ever seen just out in this program. And so I think there was, in an interesting kind of way, almost a push to be like, yeah, we're okay with it, you know, like we're all on board kind of thing. And so I was lucky in that way. I did not come into residency seeing someone. I met my wife during residency, and then it became a point of fascination that they all want to meet her. Who's this person? And I brought her to like all the, you know, graduation events and everything. And I think that, again, that helped normalize our existence, our presence at this space and all these places. It wasn't without incident. I won't try and say it was like all perfect. The day that the gay marriage ruling came down, I was a resident and engaged to be married. And though I was listening to some folks being like, oh my God, congratulations. And there were other folks being like, what's next? Bestiality. Like that was actually said in my presence in the OR. So it wasn't all, you know, smooth sailing. There were, you know, certain slurs that were repeatedly said that I would hear and try and correct as best I could. You know, so you know, anywhere you go, and I'm in New York City, one of the most liberal places on earth, but there's always going to be diversity of people and diversity of thought wherever you go. And so I think it's like, it's sort of like that shared experience, like everybody that kind of is out in residency, you get your allies, and then you get some folks who are maybe still evolving. You encounter, you know, language, you encounter situations and things. And so I think it's kind of like a shared experience, you know, like we all have to kind of deal with that at some point sooner or later. I think if you're gonna be out in these spaces, that we'll all experience that to some extent. What really helps though, again, is just knowing that like, you know, you have support, you have community. A big part of that, getting through a lot of that, legitimately was family support and my wife, you know.
Yeah, I'll just add on that. So, you know, I came out as an intern, like out as gay, as intern, just period. And so I think residency for me was a lot of kind of internal conflict that was probably more self-imposed than anything, because, you know, I guess I put a lot of substance to this identity as like, now that, you know, I have come out, this is going to be how I am thought of, period. And in reality, that was not the case at all, right? I'm just another resident from another medical school. And I think what, you know, especially once I started seeing my partner, who's now my fiance, you know, I just normalized it, you know, and so frequently I would go onto a rotation and say, and, you know, my attending trying to get to know me would say, oh, you know, do you have a girlfriend? What does she or he do? What does she do? And I have to correct them all the time, multiple times, right? And it's like, oh, you know, I don't have a girlfriend, I have a boyfriend, and, you know, and we did this last weekend or whatever. And then, you know, kind of like what Ayesha was saying, it was kind of like, oh, you know, that's different. And then there was this kind of continued question, how'd you guys meet? You know, there's like this, it's kind of you're kind of opening the door for further questioning, and because you're just not the norm, or you really are outside the box. And so you know, I think by the end of residency, you know, it was kind of a very well-known fact, like multiple residents had met my now fiance. But certainly in the beginning, it was really tough for me. I think I spent a lot of time trying to think of how to phrase this question, especially when I wasn't seeing someone. You know, someone asks, "Oh, do you have a girlfriend?" And I just say no, you know, and kind of let that kind of carry itself out. But I think it's just something that, you know, you just have to be more comfortable with yourself. And for me, that was time.
Yeah,
just want to
sorry.
pick
No,
out some.
continue.
I'd just like to pick out some threads that I'm hearing. I think I'm hearing a lot about both positive and not so positive mentorship. So thank you to Rena Jane for your question about kind of allyship. And I think the mentorship piece probably plays into that, right? Where I'm hearing like skin folk is not always kinfolk. But then also right here in this panel, we're seeing good examples of mentorship to the attendees and hearing about ways that you all have stood up and kind of paved the way for others to come. I'm also hearing a lot about kind of the way holding intersectional identities, particularly visible ones, kind of builds in a resilience that to me sounds like it really has set you all up very well for both your surgical training as well as your surgical career and being able to navigate different selves and different spaces, and kind of finding it within you to represent all parts of yourself to varying degrees, in a way that makes sense for the given situation.
Right, and particularly in terms of mentorship, I think especially when I was a junior resident and I had just come out, I thought to myself, I need to find like another gay surgeon because they are going to be my mentor, kind of like Dr. Satterwhite was saying. And ultimately, none of my mentors were gay. They were all kind of your very standard orthopedic surgeon, white male in their 40s. And I remember really being concerned, like, oh, I'm so different from them. Like, why would they be my mentor? And in reality, it was some of my other identities, right, that have nothing with me being gay that really kind of came to the forefront. So, for example, one of my fellowship mentors, like, we both love working out. So we would talk about that all the time, right? And that was kind of our shared identity that we could connect. And that was true for every other mentor, right? And so I think, I thought being gay, especially in a surgical subspecialty, would really be the most prevalent identity that I would have. But in reality, I have so many other identities, and I really needed to learn how to celebrate them because that's how we connect with other people.
And I would tag on to what Dr. Sara said, because don't underestimate who ends up being a mentor, who can be a mentor to you. I will swear by this. 2 out of my 4 greatest mentors are political view right of center / far right, straight cis white men who still saw me, believed in me, mentored me, took me under their wing, protected me, gave me opportunities that I don't think I would have had otherwise. And they did that knowing exactly who I am, what I look like, where I wanted to go with my life, and helped me get there. So again, like the allyship, that is across the spectrum. That is, I think, true across a lot of it, more and more in orthopedics as well. So yeah, I wouldn't, we talk about intersectional identities and all these things, but I would not underestimate who a mentor can be to you.
Yeah, and I agree completely. Yeah, the allyship is there when you oftentimes least expect it. And I think, what's worked for me, it's not always the case, but just the openness and also the vulnerability has helped. And I think just like what Ayesha and Andrew was saying, like one of my best mentors was my craniofacial fellowship director, but kind of an old white guy, the most conservative guy ever. He referred to CNN as a communist news network, and he felt that Obama should be assassinated. I was like, I'm like, there's things he would say politically, but he believed in me, and he opened up so many opportunities. And it was just shocking to know that I could have a relationship with this man who I loved and adored, who was like this, right? So, but once again, as Ayesha was saying, that everything is like perfect and rosy, but it is there, and it can surprise you sometimes.
Well, I want to be respectful of everybody's time. I see we're getting some more questions come in, but I just wanted to take an opportunity to thank our panelists for being here, for answering these really kind of tough but meaningful questions, and for all of your really sincere responses. So thank you all so much. And Amber, I don't know if you had any final remarks.
Well, I think I'm gonna pull rank here. When the president-elect of AOSA asked the question, I would love to address it. So if I can take another couple moments of your evening, this has been incredible so far. And I just want to, again, echo what Ezra said about thanking our panelists and also thanking the folks who have hopped onto the Zoom call. I know your time is all very, very precious. So what advice do you have about expressing your identity with your patients? And kind of how do you bring authenticity into that, given that there's so many kind of loaded perceptions that other people might have about you?
I can take that one. I get a lot of reactions when I walk in the room and they're like, "Oh, you're the surgeon." And my reaction is to always show grace, to always show grace for my patients. I have rarely encountered a situation where my patients were, hostile or, in any way, shape, or form, trying to be provocative or trying to do like I just haven't encountered that in 7 years of practice. But what I have encountered is just, people who are seeking care, they're in a difficult time in their lives where they have something happen to them and what they want is good care. And these parts of me don't always become relevant, but sometimes it can be confusing. I walk in and they're like, "I'm sorry, I'm just going to ask you, are you she or he?" I'm happy to answer that. I have patients who will mistake my gender. I'm happy to, address or not address. It doesn't matter. I'm not trying to make them uncomfortable. I have, patients that have like legitimately looked at me confused and I'm like, "Oh, don't worry. It's me. I'm Dr. Rahman. It's just my short hair. I know it confuses people." I just give them that grace. Like, I'll give you that, I'll confuse, like, I'll always do that because at the end of the day, I think most patients, what they want to know is that it's not so much about you, it's about them. And they want to know that you care about them. And however you show that to them, I think that's going to come across.
Yeah, I think this is a really, really good question because now that I'm in practice, um, I sometimes I struggle with that, and I live in Atlanta, right, which has lots and lots of Black people, but also can be very conservative, right, in many ways, and um, I think, I think about the patient relationship as ongoing. So, right, it's kind of the longer our relationship is, the more we get to know about each other, right? For me, you don't have to know that I have a fiance like the first day that we meet. But that relationship kind of grows over time. And so, yeah, I mean, I've certainly had patients that I didn't even know they were gay. And then they mention that, they have a wife or they have a husband, or I mention it. And then they're like, "Oh yeah, like my, one lady I still remember, I did a shoulder replacement on her. And it was 3 months after I met her, where she finally, I met her at surgery and I met her wife. And then I brought it up. I was like, you didn't tell you had a wife? I have a fiance." And right, those are the kinds of things that, especially in maybe certain communities where, in conservative Black communities, right, where people aren't going to be willing to kind of share all of that right away. It's an ongoing relationship.
Yeah, and I think that I've been, fortunate because when, working with the transgender and the gender diverse community, so I feel it's just such a privilege and an honor to be able to be as open as I am. But it is interesting because a lot of trans women have experienced transphobia from particularly gay men. And so there have been some patients who, like, when they meet me and they know that I'm gay, it sometimes makes them uncomfortable because of some of the experiences that they've had with other gay men. They're just like, I've had patients say, "You're like the nicest gay man I've ever met," because every other gay man just like ignores me or has been hostile or been mean to me. And it's something that I didn't, realize. And I think that's just my own like ignorance and naivete. But that was, one aspect that I had to work on as well. And I think also, for me in my practice, like, we're engaged in social media begrudgingly, but in the world of plastic surgery, you just have to be on Instagram, which I can't stand, but I do it. And so I have felt a bit more comfortable being, a bit more, personal and talking about, my identity and multiple identities and my family on social media. And once again, I don't not everyone should do that. Certainly you have to know what your limits and boundaries are, but I found that for me in the line of work that I do and for engaging with the community and my patients and for advocacy, that's certainly been important. So when patients do come in, they do know me and they do know what my background is as well.
That's awesome. I love hearing about all the nuance and all of your experiences. This has been an absolutely wonderful night. Big round of applause for all of our panelists. Thank you so much for your time and your insights. Thank you so much to Ortho Pride for the joint collaboration. This has been so much fun. I've learned so many things about your organization and the wonderful work that you all are doing. Thank you so much to everyone who's come to the webinar, for your questions, for having your camera on so we can all be in community with each other. And we really hope to see you again for the next either AOSA or Ortho Pride, or who knows what else is in store. Hope you all have a good night.
Thanks so
Bye.
much.
Thank you. Good night.